everyone. My name is Peggy Mulongo. I'm one of the mental health lecturers here at UCLan. And just briefly for my background, I'm a mental health practitioner. I've been developing expertise mainly around mental health and ethnicity. And it's just about finding too many gaps over the years through my careers, and I just decided that I'll be researching around mental health, ethnicity, gender, and particularly women, to tackle health inequality. So based on that, my master's has been done on genital mutilation and mental health, the impact, and then I completed my doctorate based on young refugees, their mental health, those who are coming here particularly under UK government program. So many different aspects when it comes to mental health and ethnicity. But today I'm here to discuss about this topic, which is focusing on domestic servitude. So we're going to try and take you through the journey of what we've done, part of this research. And I think my first question, if I have to ask just anybody, are you familiar with domestic servitude, or have you ever heard about it before? Nobody. Okay. Are you familiar with modern slavery? Yeah. Yes? Good. So, what is modern slavery? So this is just to give you kind of a background of the study. And we have here in the UK the Modern Slavery Act 2015, which will be recognizing 5 different types of exploitation. Often we talk about labor exploitation, we'll be talking about sexual exploitation, we'll be talking about criminal exploitation, and also even organ kind of collection as a form of exploitation, and also domestic servitude. Under the Modern Slavery Act 2015, it is recognized as a form of exploitation, trafficking. However, when we ask the question, most of the time people will be talking about labor exploitation, child trafficking, so it's used. But the Home Office typology, based on these 5 different forms of exploitation, is even broken days down to 17 typologies. So we have about 3 for the labor one, and then under the domestic servitude we have 3 different ones. So we have those exploited by partner, those exploited by relative, and then those who are exploited via the work that they are doing. So the last one, they will be coming here in the country legally, they will be allowed to work. However, they were brought here maybe by a family member, for example, often extended members of the family. So you will be working, but I will be controlling your bank account. So no relationship with the worker while he's working. However, the money is controlled because I am the one who brought you here. So you are working for me. So the first one, this research is mainly based on related to partner and relative exploitation. So yeah, it is affecting a lot of migrant women living here in the UK. It is a reality. So how we came across of this, we're going to see it later. But in general, domestic servitude will be affecting women. Often they enter in this country legally. So either as a spouse or as a family, as a visitor, coming here with a legal visa. And when you are here, you will come under the control of the person you are coming to visit. So often linked with, for example, in the case of spouse, often linked with forced marriage or arranged marriage, okay? And then of course it will be going alongside with any form of domestic abuse. There may be kind of interaction with domestic abuse and also sexual exploitation. But if we need to kind of separate them as a standalone, it is a crime recognized under the Modern Slavery Act. But it is a silent crime, very niche. often the women won't be able to complain. They don't even know that it is illegal. There is a law kind of that can protect them. They just assume that it is normal. Why? Probably part of the finding we'll be finding out. Okay, so severely affecting their mental health, and some of the findings, part of initial report that was produced in early 2021 by an organization called NESTAC. And this report, part of the findings of this report revealed that women were isolated, suffering in silence, feeling ashamed, depressed, anxious, so different forms of mental health issues. And then from this report, from the findings of this report, which was funded by Greater Manchester Police under the Modern Slavery Program in Greater Manchester. So then that's why it led to us developing this piece of research, having two main objectives. First of all, we wanted to look at the psychosocial impact of domestic servitude on the woman, and then secondly, trying to find out where they could get support, identifying the support if there were any outside, and then the women, part of the first report, the initial report suggested that they would like to have kind of a support point where they can go and then start receiving any form of mental health support. So data collection and analysis, and there have been 3 focus group discussions with 23 women in total. This is really kind of a small scale of research, which was funded by Global Life here at UCLan. So we 23 women were included, part of the 3 different focus groups, and then the exclusion criteria, we wanted just to make sure that, that's why I'm mentioning about small scale, because we don't have money. We didn't have money for interpretation to be able to include more women. So it was about female adult migrants, making sure that they speak English and living here in the UK. So we've excluded at that point any women victims of any other forms of modern slavery. So just trying to focus only on the domestic servitude. So Karen, if you can talk about the methodology.
Yeah, although we had Emma speak earlier on about phenomenology, so I think you've heard quite a lot about this already. We used Van Malen's approach for this, which is slightly different than Heidegger's, but I think you've probably been phenomenologied enough for one afternoon. Yes.
Okay, this is mainly phenomenology is Karen's kind of part of methodology. I'm more narrative.
Well, I was really privileged to go to the University of Utrecht and study under Max van Manen and his colleague Bas Levering from the Utrecht School of Phenomenology. So I sort of feel as though I owe it to them to do it well.
That's as we call you, the Queen of Phenomenology.
I've been called the Queen of some things. Phenomenology is okay.
Yeah. So I think maybe I forgot to mention it at the beginning. This research is part of it's based on CBPR, that means Community-Based Participatory Research. So we'll be working directly with the community, and then that's why we went back to NESTAC, and then they've been happy with the whole recruitment process. And then they've been helping us a lot in different ways as well, in terms of having participants contributing in the research. And then briefly, just you can see the different countries where they were coming from. I have a demographic, like for the 3 different focus groups here. Like you can see the first one, they were all coming from one of the local authorities, but you can see the diversity in terms of country of origin, but all being part of the same age range. In terms of religion, predominantly Muslim, but we had Christians here. And then, yeah, this is for the second focus group. Again, it's just about showing you the diversity or maybe the geographical area where the participants were coming from. Okay, so following this, these are just the headlines from what you're going to be going through for the finding. So what we've gathered is that migrant women who have been affected by domestic servitude, they are more likely to suffer psychological trauma, self-harm, and depression based on the findings as a result of this exclusion, of course. So support services out there and therapeutic intervention related to domestic servitude are unknown to the woman, and then it's also probably needs further investigation or to try and find out what is out there, if there is any form of support. Women lack awareness on domestic servitude as a crime in the UK, like I said before. So the first report was following an awareness raising and finding out, trying to ask the women, do you know about domestic servitude? What do you know? But it wasn't put in that way. It was really about making them speak, and then based on key questions, their answers, they were surprised that there was a name to put on it and that it was illegal here in the UK. So total mistrust in criminal justice and in other non-professional bodies from the women. They don't trust the criminal justice, and then they don't trust any other professional bodies, like for example, safeguarding vulnerable adults or schools as well, going to confide to the schools what will be the consequences. So just total mistrust. And then finally, they are calling for emotional and mental health support that would consider their ethnic backgrounds. And then again, based on the findings, it's mainly like some of them may have got the opportunity, but they felt like they were not understood. So yeah, so these are the headlines. So Karen, if you can go, because the findings, data collections were carried by Karen, who will be taking you through.
I can do it on here, you're right.
Okay.
Yeah. So one of the reasons that I actually conducted the interviews was because I was completely independent of this. Peggy has had a lot of involvement with this and some of the women previously. So I was completely fresh to this and looked at this through fresh eyes, through the lens of phenomenology, and of course phenomenology, of course leading me to the concept of being. So the findings are presented in terms of being a slave or a hostage, being a victim, being brave and courageous, being silenced and in fear, and being liberated and scarred. And I feel that at this point, before I actually show any of the words of the women, of their lived experience, which was traumatic, I really need to just give a little bit of a warning, actually, that some of this data is upsetting, and if you've encountered any abuse yourself in the past, you might find it triggering. So I just want to give a word of warning in order to be sensitive to people's needs. If anyone needs to leave or just close their eyes at any point, I completely understand. So I won't go through each one of these because they will be revealed through the quotes, and of course PowerPoint will be made available to everybody. So let's start with being a slave. I'm going to read these words. I think it's important though to say that I'm reading these words with a very English voice. These words were not spoken in a very English voice at all. And in some ways I feel like saying, perhaps you should read it instead. Would you prefer to read it, or would you like me to read it out? Do you want to read it? You've already read it.
Very fast readers.
Okay.
I'll read it again then.
All right. I'll move on to the next one then. I'll just read the last paragraph on this though. So they make you think they control you emotionally and then mentally. Then they make you feel that it's your duty to take care of the whole house and everything inside the house. The next is being a victim. This, I'll probably read out because it's quite small. The print is quite small, but it is tragic. This woman said, I mean, being subjected to heinous sexual acts and then being subjected to terrible, embarrassment outside, indoors, in public, everything. You just have to keep quiet because you know that otherwise the children will face the backlash of that, and you're always constantly being told, I will take your children away. You can't do anything about it. You'll never be able to see them, and it's just terrible. It takes a lot to go through something like that and then just be quiet and pretend that everything is just fine. Just keep a smile on your face when you're hiding your scars mentally and physically, and then it's really hard. Like what I was saying, who do we go to? Who do we talk to? Because all of our doors are shut, and it's done in such a way to show us that it's being done to protect us. And again, being a victim. And this woman and all of the women at some stage feared for their life and was living in a sense of protecting themselves, avoiding the next punch. But many were incredibly brave and courageous, and all of these women that I spoke to, 23 of them, all of them were survivors and were more brave and courageous. I'm going to get tearful if I don't watch it. More brave and courageous than any of us will ever need to be, probably. And that's the thing about phenomenology. When you talk to people and you're asking them to share their experience, what it is like being a person who's a victim of modern slavery, they bare their soul, and you're in the presence of this authentic exchange of information, and it's sometimes quite hard to just stay that objective researcher that is taking it on, because you're getting a subjective message, and it's important to be sensitive and acknowledge the subjectivity and the personal message, because phenomenology is never meant to be generalisable. It's always the one person, the one experience, and that's what's precious. And being silenced and in fear. This was a really big section actually, because they were in fear of being deported, and they were told that they'd get sent back to their families, which was not going to be a good outcome for them. It would bring shame upon the family. And they didn't know what right they had to be in the country. Most of them didn't have their passports. Some weren't registered with GPs. Those that were not allowed to go on their own. So even those that were liberated were scarred. And a scar may heal, but it's always a vulnerability. How can you ever move on from something like this and not be made vulnerable by it for the rest of your life? So I'm going to pass over to Peggy to talk about the recommendations that came through this.
Yeah, so it is definitely a hidden type of crime, and especially when we talk about partner and relative, like we used to. Some of them have been courageous and brave enough to go and report it to the police, but the police sends them back. Why? Because the perpetrator is often well educated, have good kind of middle class and all this. So, and then often at the beginning, the woman doesn't speak English very well. So, and then get upset when she realizes that the husband is lying, and then getting upset maybe expressed in different ways, and then agitating and all this. So automatically, they are the ones ending with order, and then taking children away, or you go away because you are the one who are aggressive. They've been kind of having the kids, that saying to the kids that you need to repeat what I'm saying, that mom is not okay, mom this and that. So the kids, if they are 10, 11, they are influenced, And then we have cases like that. But I mean, just briefly to say that that's why they said we don't trust the police, because if we go to the police and then the police either sending us back or we lose everything while we are threatened by that document, immigration, because I am the one who brought you here, you are legal, but under marriage, you need to spend 2 years together under the UK law. But if there is anything, you lose everything. So you may maybe kind of bear this for 2 years, and then when you want to go, the person needs to renew your documents. And then if it says, I'm not renewing your documents, so you become illegal. So many of them ended illegal while they came here illegally. So there are so many problems. We go to the social services, and then they will tell you that, oh, this is a domestic abuse issue. Why I could be maybe victim of violence, for example, but I can still commit war, I can, but them not, they are controlled. So there are so many things that which are emerging, and there is a need probably to raise more awareness on that. So considering the dual aspect of emotional distress described by participants, like what we are talking about, but first resulting from the abuse, exploitation they are victims of, and then secondly, just what I've just mentioned now, the immigration issue. So, and then we've been organizing a couple of sessions, workshops with immigration officers. Themselves, they don't have all the answers. It's just like the policy needs to change. So there is a need to scrutinize immigration policy. This is what we are talking about in relation with domestic servitude. Campaign against domestic servitude and safety measures should be in place, so more awareness to all stakeholders, mainly. Cultural sensitive program for them as well. This was a piece of research, but they felt like it was a bit therapeutic as well for them, so they need spaces. Online training, all these have been recommendations coming from themselves towards they would like to see out there. Training even the communities, even before they come here, before they travel here, so they are aware of the differences between domestic servitude and all this. When they come here, usually they don't know nothing. So it is important to recognize as well the partner-relative exploitations as a form of domestic slavery at the same level in terms of equity as child trafficking, sexual exploitation, which is not really recognized. And then finally providing a platform for further research on domestic servitude. And I think we think that this research has been an innovative one because, of course, we've been looking around. There's nothing focusing only on domestic servitude and based on the partner-relative exploitation. And then also, it's just like about feeding into informing the existing UK policy in terms of what needs to be changed. It might seem small, but we need to start somewhere, hoping that there will be some contributions. And then also identifying in terms of support what is out there. And the conclusion mainly is about, yes, it is important to notice the mental, physical, psychological, spiritual, themselves they mentioned it as well, and the social abuse they are victims of, and it's very traumatizing for them. Like Karen was saying, even if you escape and then you are now kind of a normal life, the mental health is still affected. Where can we get this type of help? This is still missing. So there is a clear need for further research in regards to domestic servitude, and then I put here ways forward, like a timeline of the research, starting from the first reports that I've mentioned. This research that we're talking at the moment is the second one, exploring the impact of domestic servitude. And then the third one we've started back to a few months ago, which is following this one. It is about hearing silent stories of slavery. It's about, we've listened to the victims, and then we are listening to the providers, service providers. I'm trying to find out what is out there, but it's still in progress. Interesting as well in terms of the findings so far. And then finally, this was just like a small scale we are hoping that there are still scope for larger scale, like at the national level. Thank you.
Okay, so we have still got a little bit of time for questions, if anybody's got any for us. Okay. Yeah.
Not so much a question, just a comment really. I just think it's such a hidden area, so obviously it's women and their children going through just like absolutely like unthinkable. So I think it's just to say thank you to both of you for actually doing this research and putting yourselves in front of these women and kind of like fighting their part.
Thank you. But they were incredibly brave to talk. I mean, they didn't know me. When we talk about nursing interventions, mental health interventions, we talk all the time about therapeutic relationship and building a relationship with the person you're working with. When you're a researcher, you're usually a stranger to that person. And this is a population of women who don't trust strangers, really. So I did feel incredibly privileged that they did speak to me, and very openly and authentically. And really, it was thanks to Nesta and Peggy that the fact that they did do that. And we relied very heavily upon our third sector organisations in order to facilitate research like this, because they're the people that managed to foster the trust of these women.
And I think as well, just like the online research, like kind of data collection online helped as well, because they could hide behind the
We allowed them not to put the cameras on,
so
they didn't put the cameras on, and they also didn't put their names.
They just changed it.
So some of them right at the end, after they'd spoken to me for an hour and I'd switched off the recording, some of them switched their cameras on and said hello and thank you, and that was really nice. When I saw the faces, it just was really quite upsetting, to be fair. I think it helped me to stay strong when I was talking to them, because I couldn't see their faces. There's so much that a face tells you. Yeah.
I think it's quite harrowing that you can be coming to a country through maybe marriage, or maybe a relative has asked you to come over, and this is what happens. And I don't think this is a new thing.
No.
I think this has been going on for such a long time, and it makes me think, albeit not quite the same, about when I was involved with the refuge, the domestic refuge in Preston, and I met this is over 10 years ago, I met a young, she was Polish, and she was over here with her partner, and she had two babies under 2, and I saw her when she was beaten up that particular day at a creative workshop, and he punched her eyes out, and that was only what we could see. But domestic violence, of course it happens to men as well, we mustn't forget that, but I think
that's true, and the really sad thing about these women is no matter what their injuries, they just had to keep quiet and stay indoors, and many of them didn't know who they could even go to or who they could trust, and that they feared worse than that if they did tell somebody.
I think also that's why we are looking at clarifying. It has been there for a long time, however nobody really talks about it, but also we want to detangle this with domestic violence and domestic abuse, and this is what the research that we are doing at the moment, because there's so much confusion. So when you are brought here just to do domestic calls, maybe sleeping just 4 hours a night, you need to do everything, not only for your own household, but you need to do it as well for the husband's relatives. So you are a domestic, like a slave, so you can do different houses, or you can leave the house while your husband is getting other people, even including in your matrimonial bed. So it's far more complex. In terms of emotional abuse, it's so high. And then on top of that, then you will be having domestic violence, like physical violence, or you may talk about other forms of abuse. So we want just to make sure that, first of all, there is an understanding that you can separate domestic servitude from the other ones, although they can go along. The policy is there, it needs to work for everybody. So there are policies as well for the domestic abuse and other forms of abuse as well.
So
I think if it could be highlighted, more so, because you switch on the TV and you see all sorts of things that are portrayed in, I don't know about Emmerdale, I don't watch that, but whatever it is, these different programs, so that there becomes more knowledge about it and understanding.
Well, that's what we're hoping to do.
Yeah, but it comes over time.
Yeah, but you need to get to the writers, to sort of put it
Yeah,
on.
I think it comes over time. The most important thing is the policy first. It happened back to, I remember, 2008, until we had for example, female genital mutilation. There was already an act, but it wasn't but since 2015, when they reviewed the bill, and we can see the difference. Talking about the media, we are seeing more and more kind of documentaries or programs on the TV about that particular. So the more we raise awareness, the more we show evidence. I think change will be coming over time.
Are the police fit for purpose in such situations?
Are the police fit for purpose?
Interestingly, it was the police. The first report was funded by the police because they started gathering information, but they were not too sure. So I think they are willing to see the change. However, at the first stage is education for themselves as well, because the senior may kind of spot this out, but they need to escalate it like bring it down to a full kind of education. And also our second, the follow-up of this one, I think the police is involved. They were keen to be part of one of the focus group as well. But they don't know how to approach this because they need to bind with the existing policies. So they are happy to contribute as well so that change may come at some point.
I should mention that it's 4 o'clock. Of course, we started a little bit late because of one thing or another. Are you okay for time? If you feel you have to go, well, just go. So I don't want to leave it if there's burning questions, and Angela, you seem to have one. So.
I'm just wondering, how are these things been helped
after the disclosure?
How they helped? Is like court cases and things like that involved?
At the moment, especially in Greater Manchester, it is a new initiative. So they have a women group, where they can a safe space really. I've been lucky enough that this is part of my caseload, so I'm managing that and in partnership with different other agencies. So, but it's still at an early stage, and it's about understanding their needs, really how different they may be with the other forms of violence they may already experiencing in terms of mental health, because we are focusing on psychosocial. We cannot just we are not even sure yet about what type of intervention. At the moment, it's just like mixing and making sure that in terms of ethnicity and culture, it is culturally sensitive what we are offering to them. But so far it seems to work because there was nothing, and now we start having something to give to them until it becomes more structured.
To me, I think to move away. So completely,
moving away, mainly, I would say that the fear is mainly around immigration for those whose immigration status has not been finalized yet. So it's mainly the fear of being removed back to the home country. And then because they came here under marriage, okay, so already in their own family, it will be seen as a betrayal because the families, most of them know what is happening here, and the husbands, you know. But the problem is even more severe because we have cases where the husbands took pictures of the wife, like nude, and then sending it back home to the family. It's on their family saying that she's prostituting here, so fabricating evidence. So if you go back home, you are rejected as well. So that's why the immigration bill needs to be considering these type of issues. But in terms of moving, they don't know. When they are safe where they are now, they are staying. So I'm not seeing any move like from one city to another at the moment in long term until. Yeah, this is domestic violence. That's why I'm saying it's important to differentiate because we don't have such policies yet for them. It doesn't exist yet.
I think it's also important to mention that many of these women have been told that this is their role under their religion, because if you'll have noticed the 23 participants, 21 of those were Muslim, and of course we all know that it is not in keeping with the Muslim religion to treat people like that, but it's couched in that. And you're doing some training in it, and I think you were calling it's not cultural, it's criminal.
Yeah, it's crime. Yeah.
Something like that. Yeah, because it's because they're told it's standard for their
yeah,
religion.
it's more than religion.
Isn't.
It's culture.
Yeah.
Tradition.
Yeah.
It's just like the way most of the where they're coming from, the upbringing is just like, as a woman, this is what you need to do. So as a woman, you cannot complain, even if the husband is wrong. So you need to accept. So they tend to accept too much until they wait a minute. This is too much. But what can I do?
But effectively, the perpetrators are abusing and exploiting the culture.
Yeah. And immigration.
To abuse the person. But I feel we should stop just because of the time. And thank you all.